Welcome back. We are on your side tonight with an interesting correlation. Plastic surgeons say since many of us have shifted to remote work, they've been booked up.
Yeah, it was almost shocking. This year it was really busy because I think of COVID keeping us all inside.
That is Dr. Ashley Chandler from Charlotte Plastic Surgery. She says she's been booked solid since her office reopened. Plastic surgery was already on the rise before the pandemic. According to the American Society for Plastic Surgeons, the number of procedures has slowly been rising the last few years. When stay-at-home orders began, offices had to close down temporarily and put procedures on hold. But since they've reopened, they've been inundated with people coming in to get consultations. Part of it has to do with playing catch-up from those procedures that were postponed. But Dr. Chandler says there are a few other factors drawing new patients in. One of them being people don't have anywhere to be right now.
I think a lot more people during COVID are doing their facelifts now because they don't have to be in public. You know, that's kind of one of those surgeries you have to stay out of public for a couple weeks. It's not really an issue with COVID, and a lot of stuff is covered by the mask too.
But there's also a psychological effect. All the time staring at yourself on Zoom or WebEx or Microsoft Teams, it can make you really critical of your own face. So some people are turning to what's been dubbed as Zoomoplasty.
You don't have to look at your face most of the day, right? You get to choose to go to the mirror, but now we're being forced to look at our face for many times a day for hour-long meetings. But we all have that area that we're worried about, and now we're staring at it constantly.
According to the American Society of Plastic Surgeons, more than half of plastic surgeons across the country reported that Botox injections were the most commonly sought treatment during the stay-at-home order.
So people are very into their Botox right now.
Dr. Chandler says that's what she's getting a lot of requests for too, along with other facial procedures. Many of them focused on things people see on all their video calls.
We call it like the FaceTime neck. Everyone is like, oh, when I look down in my phone, I'm like, I don't like this.
It's been dubbed Zoomoplasty, people finding flaws in the way they look virtually.
Or they're like, I didn't realize I had this, or oh, they start pinching this. And we do our consults over Zoom at Charlotte Plastic Surgery. Our first consultation we usually offer through Zoom. And so it's kind of funny because they're like, this is what I don't like, and they're like looking right down.
And for those going out in public, the requests usually have to do with the upper half of the face.
Because the mask is cutting us right across here, so that extra skin maybe like being extra shown by the mask or compressed, or even some people it like hangs over the mask, so they're hating it. So we definitely see an uptake of eyelid stuff, which usually in the summer we don't see.
And you may be wondering how something so expensive can be on the rise when we're dealing with a rough economic period. In a CBS report earlier this week, one doctor suggested it could be because so many other businesses are closed right now.
I'm not spending money on movies, travel, dining. I can put that money to, having some spoiling of myself at home, almost like a staycation except for your face.
And when it comes to safety, Charlotte Plastic Surgery says it's taking precautions to make sure every patient is safe. Dr. Chandler says first consultations are always virtual. Then a few weeks later, there is an in-person consultation. Temperature is checked at the door, and nobody sits in the waiting room.